Hello everybody and welcome to this video. In this video, we are going to talk about shock and specifically we're going to touch on cardiogenic shock. So let's get started. First of all, when we talk about shock, what is the definition of shock? It's basically low blood pressure. That is uncontrollable, actually, hypotension. And even by giving IV fluids, it's really hard to rise that blood pressure. This is shock. And why is shock really bad? Why is low blood pressure really bad? Because when you have low blood pressure, it means that your circulation is very poor. It's very compromised. And when it's very poor, your O2 delivery is very poor as well, right? Especially for those noble organs like the heart and brain. And you could imagine what could happen if your O2 delivery is compromised. You might develop ischemia and tissue death. That's really bad, and it might lead to death, actually. So we have to actually treat this condition in the ED. It's very severe. So um, before we talk about cardiogenic shock, let's talk about the types of shock. Before we do so, we can explain this by talking about blood pressure, actually. It's blood pressure equals cardiac output times systemic vascular resistance, right? Okay, so how can we have a low blood pressure? It's by either having low cardiac output or by having low systemic vascular resistance, right? If you have a low cardiac output, well, that's the case in three types of shock, actually. It's the cardiogenic shock, it's the obstructive shock, and hypovolemic shock, right? Why? Because in cardiogenic shock, your heart muscle is failing. It's gonna pump blood. When you can't pump blood, your stroke volume is going to be low and your CO is going to be low. Why it is the case in obstructive shock? Well, obstructive shock means there's something obstructing the preload to the left ventricle, like in pulmonary embolism, where the pulmonary artery is having a thrombus obstructing the blood flow into the left atrium and into the lungs, left atrium, and into the ventricle eventually, right? Um, how about the hypovolemic shock? Same thing. You have no blood volume. You have no venous blood to be sent back to the left atrium as a preload to the left ventricle. You have very low preload, which means very low stroke volume and a very low cardiac output, which can lead to hypotension. But what if we have a low stroke volume? Well, this is called distributive shock. And distributive shock, it actually has three subcategories: the septic shock, anaphylactic shock, and your neurogenic shock. But this is not our discussion in this video. Our discussion is basically cardiogenic shock. Because here on the left-hand side, we have a patient suffering from cardiogenic shock, as you can see in this case report here. Okay, so this is a question, and they're asking me about the physical exam findings in a patient suffering from cardiogenic shock. So let's go and read it. 68-year-old man, history of MI. He has a heart condition. He's presenting with acute shortness of breath and weakness. On examination, his blood pressure is 85/55. That's very low. That's shock. And his heart rate is very high, tachycardia, respiratory rate is 30, tachypnea. His body is trying to compensate for that hypotension, okay? He's trying to compensate to rise that blood pressure back to normal. And his O2 saturation is also in the lower side. So the question is asking about the physical exam findings, especially in the skin and in the lungs and the jugular veins, right? So three body parts. What will we see in these body parts in physical examination? Okay, so let's talk about the skin in the beginning. So they are talking about cold and clammy, hot and dry, warm and flushed, etc. So they are talking about the temperature and the humidity of the skin. Okay, so I'm going to ask you a question. What is the determinant of the temperature in the skin? Well, I hope you are thinking about blood flow. Blood flow controls temperature, of course, right? If your blood flow is high, it's going to be hot. If it's low, it's going to be cold. Well, the question is, what do you think is going to happen in this condition? Is it going to be hot or cold? I.e., your blood flow. Is it going to be compromised or rich? What do you think? Well, go back to pathophysiology. It's our and only, it's the one and only evidence that we can go back to, right? So blood pressure equals cardiac output times SVR. So in cardiogenic shock, our cardiac output is going to be compromised, so the body is going to rise that stroke volume, right? How? By constricting blood vessels, especially those on the skin. So cutaneous vasoconstriction is going to be happening by sympathetic response. Also, that sympathetic response is going to activate sweat glands, right? So the skin is going to be cold and clammy. The word clammy basically means moist, humid, right? It's the opposite of dry. So we are going to omit any choice saying hot and dry, warm and flushed is incorrect, and choice E is also warm and moist is incorrect. It's cold and clammy, right? Let's move on to the lungs. What's going to happen in the lungs? Is it going to be on auscultation? What do we hear? Will we hear bilateral crackles, or is it going to be clear, like normal? Well, what is going to be happening in the lungs in cardiogenic shock, especially in the terminal stages, let's say? What's going to happen is blood is going to be accumulating in the left ventricle because it's not going to be pumped from the left ventricle into the aorta. It's going to be accumulating there, eventually backing up into the left atrium and then into the lungs. So lungs are going to be filled with fluid. This is called pulmonary edema, right? And on auscultation, we can hear bilateral crackles, of course. If you understand that, you can understand also that even in more terminal stages, lungs cannot even tolerate that much blood. And this might lead to pulmonary hypertension, sending the blood into the right ventricle, and from the right ventricle into the right atrium, which is going to lead to what's called JVD or jugular venous distension, i.e., an elevated pressure in jugular veins. So in this case, the correct answer is going to be A. Why? Because the skin is cold and clammy from the sympathetic response, constricting blood vessels and activating sweat glands. Lungs, of course, bilateral crackles from the pulmonary edema and an elevated jugular venous distension from or by the same reason. This was our video for today. We talked about shock in general. We touched on the four types of shock. And in the end, we actually talked about in detail what do we see on physical exam in patients who are suffering from cardiogenic shock. I hope you find this video helpful and let me know if you do so. Peace.